Hi, everybody. Welcome back to our three-part series on what you need to know about the state of homelessness. Thanks again for joining. We'll give folks a couple of seconds to jump into the meeting, and then we'll go ahead and get started. So for those of you who may have missed the previous two webinars, we focused on the causes of homelessness and how these causes impact specific groups. In other words, we tried to show you some trends in who and where people experience homelessness. So there are recordings available, and those we'll have those sent out fairly soon. We encourage you to also check them out when they are posted to our website. But today we want to move away from just describing the data and identify what we can do to solve those trends in homelessness and housing insecurity that we described. And before we begin, I'm going to invite my colleague Andrew to go over a few ground rules.
Hi, everyone. My name is Andrew Hall. I'm a research analyst at the Alliance with Daniel. I just wanted to go over some ground rules, as Daniel mentioned. The Alliance strives to create an inclusive space that welcomes diverse voices and opinions. Discriminatory or abusive language or behavior that puts people at risk won't be tolerated. The chat is not going to be open for this webinar, but please do let us know if you feel unsafe for any reason. I'll be monitoring the Q&A and leave time at the end to address any and as many of your questions as possible. So just for a few housekeeping items, our webinar will be recorded, including the PowerPoint slides. If you want to follow up with us on anything that we say or cover in this webinar, you'll be able to do so at any point. And as Daniel mentioned, these will also be shared on our website and to participants. So now I'll kick it back to Daniel.
Thanks, Andrew. So for those of us who look at this data often and some of the data we discussed previously, and for any of you who work to ensure that unhoused people have a safe, dignified place to live, upward trends in homelessness over the past couple of years are not entirely surprising. For more and more people, the rent is too high and there are too few resources when crises hit. We discussed these things in our previous webinars, but current policies and funding streams are just not serious about ending homelessness. They're really grossly insufficient to help everyone who is in need. And incremental increases in resources helps a lot of people, but it's not enough to connect everyone in need with housing and services that they need to exit homelessness. So what we have here is a chart that in the orange bar is where you can see that everyone who is currently experiencing homelessness on the night of the annual point in time count. And then in blue, we see the amount of available permanent housing for people experiencing homelessness. We see that the homeless system only had enough available permanent units to serve 8% of this population in 2024. And while we discussed it, or as we discussed in previous webinars, the point in time count is an incredible and extremely helpful source of data collected by dedicated workers and volunteers. And it's the best source of data that we currently have. It's also likely an undercount of all the need. And so in addition to only capturing a single night, it's hard to identify everyone in need, especially in remote areas. So put simply, even this is likely an underestimate of the scale of the need. Homeless service providers do not have the resources that they need to end homelessness. And yet, we're also seeing that they're finding ways to serve people more efficiently and serve more people than ever. On the right, we see large increases in the number of people experiencing homelessness each year. And by connecting people with shelter, medium-term housing subsidies, permanent housing, and supportive services, the response system is getting as many people as possible the resources they need to accomplish their goals. Unfortunately, lawmakers do not give them enough resources to serve everyone in need. And just as we know that the homeless response system is meeting these really incredible targets despite having few resources, we also know that with more resources, it could serve even more people. And how do we know this? We look to current and previous examples of success. Abundant research, local stories, and historical trends demonstrate that ending homelessness is possible. For example, a review of 65 reliable academic studies that captured over 17,000 participants emphasize that housing compared to studies, which these studies emphasized housing as the solution to homelessness, addressed chronic homelessness more effectively and decreased homelessness more effectively and with far greater success than purely addressing mental and physical health concerns. These approaches use tax dollars more effectively than punitive approaches, and they provide long-term solutions rather than spending money to dislocate people or create an endless cycle of homelessness. Many housing-focused solutions are ultimately cheaper than punishing people. And there's also numerous communities across the United States that have invested and are investing in housing-focused solutions to homelessness. They're reducing homelessness even as the population who needs support is growing very quickly. And so our team has spoken with a number of communities and do so every year, places like Newark, New Jersey, and West Tennessee. And we've learned about their efforts, what they're doing, and what approaches they're taking to help them achieve their goals and make sure everyone has a safe place to live. Homeless service providers partner with affordable housing developers, government officials, landlords to more quickly and efficiently expand the supply of affordable housing. They also conduct careful outreach to people living outside in close partnership with health providers and other social service organizations. This makes it easier to connect people in need with the services that could help stabilize their housing. They also listened to and employed people who had formerly experienced homelessness, ensuring that their community members helped lead efforts to end homelessness. These efforts demonstrate that with careful planning and sustained investments and resources, communities really do know how to end homelessness, and especially unsheltered homelessness. In addition to these local examples, housing with voluntary services like healthcare also has a strong track record at the national level. In 2009, the U.S. Department of Veterans Affairs launched the Ending Veteran Homelessness Initiative and collaborated with HUD to implement specific services for veterans experiencing homelessness. During this initiative, a federal evaluation found that veteran homelessness decreased 55.3% compared to the 8.3% decrease among the overall population. So far exceeding decreases among the overall population. And they noted a few things that really drove these decreases: providing housing with robust voluntary health services and case management from trained professionals. And unfortunately, these decreases in veteran homelessness have slowed because support for these proven solutions stagnated, which is what we see in the graph on the right. So without sufficient funding to meet the need for these programs, homelessness increased. These studies and examples prove that we know how to end homelessness, but there's also this other question of whether we have the resources to provide these solutions to everyone in need. And the simple answer is yes. The more complicated answer is that decision makers do not always prioritize these solutions. So recent research by the Alliance and academic researchers at the University of Pennsylvania estimated that it would cost $9.6 billion to house and provide services to everyone currently experiencing homelessness. And while this may seem like a large figure, it really pales in comparison with US spending on other programs and policies. So we pulled a few numbers to try and give you a sense of what $9.6 billion means relative to some other things. Specifically, it's less than the amount that the Department of Defense plans to spend on submarines in 2025. It's also far less than the budget of or the value of certain privately traded companies or publicly traded companies. So it's worth noting that subsidizing permanent housing and services is also only necessary for a small number of people. Not everyone requires this intense long-term support. And so this more broadly, providing someone a safe place to live can also save costs, as we mentioned before. It's often less expensive to house people than the various costs associated with being unhoused, which might be emergency health care or interactions with the criminal legal system and other social services. This is especially true for people who just need rental assistance or temporary support rather than that long-term and prolonged housing and services. So again, just to simplify and make it super clear, the United States does have the resources to end homelessness, and it's really in all of our best interest to invest these resources in what we know works. But it's also important to note that keeping people housed and preventing them from entering homelessness is also important. Conservative estimates put the number of people entering into homelessness each year at over 1 million people. During our first webinar, I pointed out that unaffordable housing and insufficient incomes drive people into homelessness. And Andrew mentioned last week, the more extreme challenges that certain groups, people of color, transgender people, and others face accessing housing. So knowing these causes and these trends help point us toward clear, urgent solutions that can help not just house people, but make it easier for people to stay housed and ultimately prevent homelessness in the first place. Some of these broad areas include expanding the development of deeply affordable housing and making sure that existing affordable housing remains affordable for people who live in it. Increasing rental assistance to low-income people is also important to make housing affordable, ensuring that people can access and afford health care, and protecting people from housing, employment, and other forms of discrimination that can make it more difficult to find and stay in housing. So my colleague Andrew will be sharing some resources in the chat, or we'll share those at the end, which provide a little bit more nuance about some of these solutions for those of you who may be interested. But for the purposes of this webinar, it's really most important to point out that these proven solutions will not get expanded unless their lawmakers, constituents hear from them. People like yourselves are really speaking to them and saying that we need these real solutions. So to talk a little bit more about how folks like all of you on the call and all of your networks can get involved and spread this message, especially to your lawmakers, our Vice President of Policy and Practice of the Alliance was kind enough to join us today. And we'll tell you a little bit about what we need to both serve people currently experiencing homelessness and really advocate for these long-term solutions.
Great. Thank you, Daniel. And good afternoon, everybody. As Daniel mentioned, Marcy Thompson. I'm so happy to have the opportunity to be here to talk with you. I'm going to try to put a few things in the chat while I'm talking, if I can figure out how to do that. But one of the things that I always, I'm not going to be successful in doing that, but one of the things that I always try to lead with is I believe in my heart that advocacy is love in action. It is a tool that we all have to fight for the things that we need. And many of you may not identify currently as an advocate because you think advocacy only applies to lawmakers, but we advocate every day for our kids, for our clients, all of those things. We have those skills. And to Daniel's point, how do we start to use those to fight for more resources for the things that we need to be able to solve these really big problems? At the Alliance, we primarily focus on the policy team. Most of our advocacy is around HUD-related programs and specifically HUD homelessness programs. And the things that we are spending a lot of time on every year is around the appropriations process. So that's where we talk to our lawmakers and push our lawmakers around how much funding is going to be available for these programs that are really important. You all have probably been hearing a lot on the news around the continuing resolution. That is part of the appropriations process to help keep the government open, but we're still in the middle of that process. We don't have final funding. So our fight around funding resources continues. And I will get some materials in the chat in just a minute. But that is a big part of the work that we do is around increasing federal resources and the right resources to address homelessness and housing instability. We also do a lot of work with lawmakers that are focused on making programs more effective we take into account all of the great things that our research team learns that they know, and we put that into policy recommendations for lawmakers to be able to make sure that the programs that they fund work for the people that need them. And to some extent, some administrations, this is easier than others, but sometimes policy doesn't uh, require congressional action. So our work, our advocacy might be more about engaging with federal agencies about what they can do within their power to make programs better. And then sometimes, and currently the moment that we're in right now would qualify. Sometimes our job is to advocate to oppose different threats or things that are coming out of Congress or from the administration that will harm folks that are experiencing homelessness, or that will make the jobs of the providers that are doing this work, make their jobs harder. There are uh, currently a number of threats to the homeless services programs uh, that could impact as many as 170,000 people losing their permanent housing, as well as communities potentially losing big portions of their funding without a whole lot of time to plan, which is super scary and super problematic. Uh, and it is taking everything and everybody to be able to inform our lawmakers of why these things are problematic. The link to sign up for our advocacy resources is right here. And again, when I stop in just a minute, I'll put some other resources in the chat to fill you in on what some of these things are. But if we can go to the next slide. I want to just spend a minute to talk about, again, you may not identify as an advocate. You may think, I'm not comfortable calling my lawmaker. I'm not comfortable. What do I say? I don't know what to say. There are so many different roles that we can play in advocacy. Not every single person has to be the one in the lead role that's, creating the talking points or delivering the message. Some of us might be more comfortable being more of a support role. Maybe you know folks that have connections or that have resources, or maybe you have information that would be valuable to make the argument that you can share with the folks that are in the lead role for the for whatever thing is being discussed with your lawmakers. And sometimes you're just there to maybe inform. You don't want to play a big role, but you could. You're getting newsletters from the Alliance. You could forward that email to other people in your community so they know that this is an opportunity and can get engaged. So there are ways for all of us to make a small difference, and every single person's voice counts. In advocacy, I absolutely believe that quantity matters, that Congress hearing the same message from as many people as possible is so important. Hearing from their constituents who they work for is so critical and important. And so we do our best to provide folks who are either, they've been doing this for 20 years, or I'm brand new and not sure what to do. We work hard to give you tools and guidance and materials, and I hope that you'll sign up for our action alerts and stay informed. And we hope you'll join us in our advocacy going forward. So thank you, Daniel and Andrew, for having me here.
Thanks so much, Marcy. And maybe some of the resources that you are going to drop in the chat or that Andrew already has, I listed here as well. So we definitely encourage everybody to check those out. They're incredible resources for learning more and getting more details about some of the things that Marcy was mentioning. So with that, we are towards the end of our time with you all, but we do want to leave a little bit of time for questions and open the floor to our Q&A as well as chat. I guess I'll just start with one of the questions that I saw in the Q&A, which is, has research been conducted on programs that implement workforce intervention or workforce interventions versus housing first. And thank you for asking that question. The answer is absolutely. Time and time again, we see that housing first interventions for people with disabilities or who might need that wraparound healthcare support and other forms of support is extremely effective at keeping people housed in permanent housing. Um, and compared to other interventions, it is abundantly clear that it works well. So thanks for that question. I'm getting some feedback that my audio is not great, so I don't know, Andrew, if you want to try and take a few of the questions, maybe yours is better.
I was also experiencing technical issues on my end. Sorry about that. Uh, so there was a question about rural communities. So we don't have a lot of information from the annual pay counts on the length of time people experiencing homelessness in rural areas, but we do know that rural homelessness is increasing and that rural communities do need, you know, additional resources from the federal government and people experiencing homelessness in rural areas do have specific challenges that places in urban and suburban areas don't. So we're certainly looking more into that and finding out like what else we can do to serve those people.
Andrew, there's a question about an action alert, if I can just
Sure,
touch
go
that
ahead.
real quickly. I will put this in the chat. We do have so we call these action alerts. This will show you, if you click on this, you'll see how easy it can be. You fill out a form and a message will would go to your legislators. This is now, the language is now out of date because the continuing resolution is already passed. We will be updating that. So if you sign up for our action alerts generally, you'll get a new message next week that will inform what the next step will be there.
Uh, so I think also to answer Michaela's long question, or sorry, Michaela Long's question, there has been a lot of research comparing housing first approaches to treatment first approaches. We can certainly start sharing some of those links in the chat uh, if that's useful. Looking at more of the questions.
There was one question. Hopefully, is my audio a little bit better now?
Mhm.
Okay. Sorry, everybody. There was one question about increasing affordable housing. There might be a link in the chat that Andrew dropped from some research that a partner organization, the Urban Institute, has done on increasing affordable housing. I think that's a great resource, and there are many others out there, both from Urban as well as other organizations, if you want to get more into the weeds of that topic. There's also the follow-up question to that about balancing the need for more affordable housing versus supportive housing. One of the things that a research partner of ours always says is we need more housing, period, which is certainly true. There is not enough affordable housing, and people with the lowest incomes, as we discussed in the first webinar, are going to be the most impacted by that shortage. But across the board, I think people are feeling the impacts of rising housing costs at all levels of income. So we need more housing, period. I do think we're at time. I'll just briefly say that there was also some of the communities we mentioned, we have publications about on our website. So if you want to learn more about the specifics of what they did, like Newark, New Jersey, or Atlanta, Georgia, definitely head to our website, check out those resources, and maybe use them when you go to advocate with your lawmakers and follow the tips that Marcy gave you today. So thank you, everybody, for joining us. Sorry about some of the technical difficulties, and we'll look forward to seeing you next time.
Bye.